Hello everyone, let's have a discussion on the very important topic for the NEET PG, that is the development of the heart tubes. Let's have. तो हमें देखना है how the heart tubes is developed. So let's have. हमारे पास होता है there is sinus venosus and we have the sinus venosus are there. So firstly, left horn of the sinus venosus, this is going to form the coronary sinus. The right horn of the sinus venosus is a one which is going to form the smooth posterior wall of the right atria. So left horn of the sinus venosus is coronary sinus, right horn of the sinus venosus is the smooth posterior part of the right atria. Basically atrium जो होता है उसका posterior wall smooth होता है और rough part जो होता है वो anterior होता है. Then it's easy. So sinus venosus, then there is a primitive atrium. Now this primitive atrium forms the rough anterior wall of the both atriums. It's there. Then we got moved outside. Then we have the primitive ventricle. Now primitive ventricle forms the trabeculated part of the left ventricle, right? Then with the bulbocortis, you have to divide the bulbocortis into two parts. What is that? You have to divide it into the distal part and the proximal part. Distal part को हम एक mnemonic से याद रखते हैं DCI. Distal part को हम conus बोलते हैं, इसको हम infundibulum बोलते हैं, and it's a smooth outflowing part of the both ventricles. This is a trabeculate part of the both ventricles. This is DCI. That is a smooth outflowing part of the both ventricle. Now the proximal part of it. Now proximal part is the one which is further divided to form what? The proximal part is the one which is going to form the trabeculated part of the right ventricle, right? So this is the trabeculated part of the left ventricle was here, trabeculated part of the right ventricle is here, and the last is truncus. At all the conotruncal defects, there is a conotruncal septum also, all that defects occur here, and with the truncus arteriosus. What is truncus arteriosus? In this you have to remember there is a formation of aorta and the pulmonary trunk. So this was about, let's have in the last discussion, right horn of a sinus venosus forms the smooth posterior part of the right atrium, left horn forms the coronary sinus, primitive atrium forms the rough anterior part of both the atrias, primitive ventricles form the trabeculate part of the left ventricle, bulbocortis firstly divided into proximal and distal. Distal को हम conus बोलते हैं, infundibulum बोलते हैं, which is the outflowing part of the both ventricles. Proximal part is going to form the trabeculated part of the right ventricle, and the last is truncus arteriosus, which is going to form two parts, pulmonary trunk and aorta.